Tonight on First Tuesday, we were told it could never happen again. But 30 years on, thalidomide has claimed a new generation of innocent victims. We investigate its misuse in Brazil and its quiet return to Britain. Good evening. We thought we'd finished with it, consigned it to history under the heading Never Again. The thalidomide scandal was man-made, a drug which caused birth defects in thousands and thousands of babies. Remembering it, mothers are slow to take so much as an aspirin during pregnancy, and stringent drug testing standards have since been introduced. It was a bitter lesson, costly in terms of human suffering, but one we felt we'd surely learned, one we felt was over. So how can it be that we've once more been able to pick up the trail of thalidomide, the drug that came back?
Just open wide. Yes, there's a couple of ulcers there. Oh, there's some...
Jennifer, a patient at a Nottingham hospital, is receiving treatment for a rare but agonising disease that can cause severe ulceration of the mouth.
Further back in your
No,
mouth?
nothing
Not
at all.
Or down in your throat?
No, nothing at all.
I think we've all had the odd small ulcer in our mouth, which is quite painful. But I think you have to imagine people with 30 or even 100 ulcers in their mouths. It's very easy to be glib about one mouth ulcer. That's not what we're treating here. And we only treat people with severe, disabling, oral and genital ulcers.
Today, Jennifer's cured, thanks to what she regards as a miracle drug. On the bottle, it's called CG217, but that's just a code name. It's far better known by another name, thalidomide. Introduced in Britain as Distaval in 1958, thalidomide was invented in Germany and marketed around the world as a sleeping pill and tranquilizer. The makers claimed it was completely harmless. So safe, it was especially recommended to pregnant women for morning sickness. In reality, thalidomide was the single most damaging drug ever used in modern medicine. It affected or killed more than 12,000 babies in 48 countries. It is now believed that just one thalidomide tablet taken in the sensitive period of pregnancy will be certain to cause birth defects. As well as damaging limbs, the drug affected ears, eyes, internal organs, and in some cases caused brain damage. 40% of thalidomide babies died soon after birth. By 1962, when the evidence had come in, thalidomide was banned or withdrawn worldwide, and strict safety procedures were brought in for all new drugs. The thalidomide children themselves grew up to astonish the world with their abilities. This unique group of people see themselves not as disabled, simply different, not victims, but survivors of a medical tragedy that could never be allowed to happen again.
In about 60 years' time, thalidomide people will be extinct. We'll go down in the history books as a generation of people that will, or at least should, never appear again. And we're just a blip in the history of mankind.
Last year, that one-off group came together for their first international conference. Apart from thalidomide, the only thing that all these people have in common is their age. Everyone here was born between 1958 and 1963, the time capsule when the drug was available. Their own babies, the next generation, are all physically normal. The delegates here represent the 8,000 thalidomide survivors from around the world.
And they would just remove that little finger. See this little? Yeah. That looks as though it could have been.
As well as 460 in Britain, 3,000 in Germany, and nearly 1,000 in the rest of Europe. Thalidomide survivors are found in Japan, Africa, Asia, and Latin America. In Brazil, thalidomide affected 260 people. They're still fighting for adequate compensation after 30 years. But now, the Association of Brazilian Thalidomide Victims has a new issue on the agenda. It's hard for them to believe, but over the years, thalidomide has quietly come back to their country. Doctors are now using it again throughout Brazil. It's something that horrified the association's president, Rosângela Nascimento, when she first heard about it.
I was completely shocked and terrified and afraid of the consequences, because I know that here in Brazil medicines are not strictly controlled. People buy any kind of drug in pharmacies without prescriptions, and then they pass drugs around to other people who also don't have prescriptions. So it's really dangerous.
Brazil's use of thalidomide is controlled from the capital, Brasilia, by the Ministry of Health. How strict are their safeguards? In charge of the health program that controls the use of thalidomide is Gerson Penna.
It's not allowed to give them for women. So you don't give for the woman the advise them that it's not possible to get pregnant. We don't give them to this thalidomide. We use for men. There is a strong recommendation from the Ministry of Health for the doctors, so it's not allowed, it's prohibited to use this medicine for women. So you can use for men.
The Health Ministry also claims that there are no new victims of thalidomide. But Rosângela has recently heard disturbing rumours.
I have heard stories about cases, but up to now I haven't had a chance to look into them, to see if they are true. All we hear are rumours.
So she's set off to follow up one of those rumours. She's heard that in a small town just a couple of hours' drive from her home, there's a boy who might have thalidomide damage.
Good afternoon.
Hello.
I'm the president of the Association of Thalidomide Victims. A friend told me that you might have a son who is also a victim of thalidomide.
I do, yes.
How old is he?
He's 10.
10? I'd like to meet him, if I could, please.
10-year-old Fernando has the classic signs of a thalidomide-affected child. Yet he was born 20 years after the drug was withdrawn worldwide. It's the first time the outside world has seen evidence like this. Rosângela checks the family's story.
Are you really sure he's a victim of thalidomide?
Yes. I'd been taking it for 2 months when I realised I was pregnant. But you see, I had already been taking the pills. I was very sad, very upset because of Fernando's problems. But I don't have any regrets, because he's my son. He'll always be my son.
Despite the government's confident claim that there's never been a case, Fernando is officially recognised as a thalidomide victim. He even receives a disability pension of £9.50 a month. And the reason that a woman of childbearing age was taking thalidomide, Fernando's mother Maria suffers from leprosy. One of the most misunderstood and feared diseases of all time, leprosy has always been a problem in Brazil. Now curable, it's a disease that once meant isolation and sometimes mutilation for its victims. Today, Brazil has the second largest leprosy population in the world, officially put at 300,000. Others say it's closer to 1 million. And while in other countries leprosy rates are declining, in Brazil it's steadily growing. It's not the face that Brazil likes to present to the rest of the world. The carnival and beaches of Rio have earned Brazil its reputation as a luxury holiday destination. Its cities are as modern and glamorous as any in the first world. But most Brazilians live in a world where tourists rarely venture. More than half of Brazil's 150 million population live in poverty, many in squalid slums with no proper sanitation or clean water. 40 million are malnourished, 12 million are illiterate. Life expectancy for the slum dwellers is as low as 39. Infant mortality as high as 1 in 10. It's exactly these conditions that foster the spread of leprosy, a disease that's transmitted through breathing, not by touch. In Brazil, a new case of leprosy is diagnosed every 18 minutes. Dermatologist Jose Augusto Neri runs a leprosy clinic in Rio de Janeiro.
Leprosy is usually found where you have large masses of people living in poor social and economic conditions. You find the largest numbers of leprosy patients in Rio, in the big slums, where you get sometimes up to 10 people living in one small room. That's how leprosy is spread.
Right. It's confirmed. You have a lack of feeling in your hand. You have a disease called leprosy, but you will be treated for it and you'll be fine. Okay.
Leprosy?
Yes, leprosy.
My family scared me.
Scared you? Why are you afraid of having leprosy?
Because it's a disgusting disease. It makes your body fall to pieces.
Fall to pieces?
Scared stiff.
You don't lose parts of your body with leprosy? That won't happen.
Contrary to myth, leprosy does not eat away at the flesh. Mutilation is a secondary effect caused by nerve damage.
Leprosy attacks the nerves, so the patient loses the feeling in his hands and feet. This leads to accidents and wounds. But because he doesn't feel any pain, the patient doesn't notice the damage, so the wound gets infected, it goes rotten, and he loses his fingers or his toes.
Modern drugs can now cure the disease long before mutilation occurs. But in the past, Brazil's lepers were forcibly shut away in special colonies. That policy was abandoned in 1976, and the colonies turned into hospitals. But many of the original residents still live out their last years in them. Brazil's new generation of leprosy sufferers are treated in the community. This is the Monday morning queue at a leprosy clinic in a suburb of Rio de Janeiro. Treatment is with a combination of powerful antibiotics. They're highly effective, but unfortunately, 10% of patients suffer a reaction to the drug treatment. It's for this side effect, called the lepra reaction, not the disease itself, that thalidomide is used. Thalidomide is approved and recommended by the World Health Organization, the WHO.
Certainly, WHO recommends the use of thalidomide for treatment of lepra reaction, subject to the precautions to be taken, and also to make sure that this drug is not administered to women of childbearing age because of the known risks. What we would recommend is use thalidomide when it is absolutely necessary, when other drugs have failed. And certainly thalidomide is a good drug.
Although thalidomide is cheap and easy to use, it's not the only drug that can treat leprosy reaction, say its critics.
Well, I think there are alternative ways of managing these lepra reaction. One can vary the dose of the drugs, one can add a little bit of cortisone, one can use alternative drugs. It seems to me that there are really no valid reason for using thalidomide. And there are alternative ways of treating leprosy, which are quite satisfactory.
If you have leprosy, in some cases you have to use thalidomide. There is many articles in the books that say it's really very nice for these patients. It's not for all leprosy patients, a special leprosy patient that have to use that.
Since 1977, thalidomide has been manufactured for the Brazilian government by this company, Funed. It's established worldwide as a treatment for leprosy, but have any problems ever come to the notice of the WHO?
So far, we have not received any information that in the use of leprosy, there has been any problem in recent years.
Yet behind the walls of this isolated leper colony at Ubar, 200 miles north of Rio, this girl, Maria Ribeiro, was born affected by thalidomide more than 21 years ago. Her mother was taking it for leprosy. Did the doctor who prescribed thalidomide warn her of the risk if she got pregnant?
Before I got pregnant, the doctor didn't say anything. Afterwards, I went to see another doctor, and he said I mustn't take it. But I mean, I already had taken it.
Maria rarely ventures beyond the colony walls, sensitive to the prejudice in the outside world.
People are prejudiced. Whenever I go out in the streets, people start staring and whispering, and it makes me feel uncomfortable. People leave you feeling embarrassed. People stare and say, "Oh dear, poor thing." They go, "Oh, what a pity." That sort of thing's horrible for anyone. It's as if you're inferior to them. It's always unpleasant.
Você comentou que uma amiga sua gostou muito. Ela falou que adorou. Então, eu trouxe para você dar uma olhada.
Maria has never received a penny for her disability. She supports herself by selling cosmetics to colony residents. Maria was not the only thalidomide person that we found hidden away behind the walls of a former leper colony.
Ciao. Ciao.
This is the tourist resort of Fortaleza in Brazil's northeast. People come to these beaches from Europe, the United States, and all over Latin America. But away from the seafront hotels, on a dirt road leading out of town, is Fortaleza's leper colony. The past medical director here prescribed thalidomide to many of his patients. But one of them, Maria Souza, didn't know that she was pregnant at the time. When she refused to have an abortion, the director gave her a document to sign.
He said, because he was the director here and held all sorts of other positions, I could destroy his career if I put the blame on him. He said if I wanted to have the child, I had to sign a statement which meant that I took responsibility from the doctor. I had to take the blame. Do you get it? Then he said to me, there's no way that your baby will be born perfect. But I signed the paper, and I took the blame so that I could have my baby. And sure enough, he was born truly handicapped, with no legs.
Her son Hercules is now 9 years old.
To have a child like this and to know that it was all because of a medicine. Sometimes he asks if he can go out and play with the other kids, and I have to say, no, you can't go crawling around. Then he turns on me and says, why did he have to take that bloody pill, Mum?
Hercules enjoys his schoolwork, but his parents now struggle to find the cost of his education.
I've never regretted having him. If he carries on doing well at school, you never know. He might turn out to be my pride and joy.
Hercules already has an ambition in life.
I want to be a doctor.
Hercules' parents receive no financial help for his disabilities. Officially, he doesn't exist. It's easy to see how cases like Maria and Hercules can be hidden away in the old isolated leper colonies. But what about the new policy of treating leprosy sufferers in the community? This is a grim satellite town for workers who serve Rio de Janeiro. The local health post treats over 2,000 leprosy sufferers. Are the controls on the use of thalidomide any safer here? In the files, we found the case of this woman, Maria Roque, aged 27. Her records show she was prescribed 20 milligrams of thalidomide daily for leprosy reaction in October 1982. But 3 months later, the next entry, pregnant. No mention of the outcome. That was 9 years ago. Maria's daughter Michelle was born with a cleft palate and legs so deformed that they were later amputated. Did the doctors explain the risks to Maria when they put her on thalidomide?
No. All he said was, "Are you pregnant?" He said a pregnant woman couldn't take it, but he didn't say why. He didn't explain. She was born with both legs deformed. Her legs were almost coming out of her stomach, and her lip was open and her mouth joined to her nose. Her palate was completely open. I was furious with the doctor. I went there and I wanted to... If I'd had a gun, I would have shot him. Really, I would. I went there crying. I told him what had happened, and all he could say was, "Well, my child, that's life." That's all he could say.
Michelle has a pair of simple artificial legs which no longer fit her properly. And getting around on them is a painful struggle for her.
It's hard for her to get to school. She can't sit on the bus seats because her legs are straight. They don't bend. So a lot of the time she has to travel standing all the way into town. She has to travel standing. She can't fit into a seat because her legs can't move. She can't bend them. Sometimes the bus driver refuses to take her to school because of the trouble she has getting on the bus. There are many times when the driver won't stop for us. Sometimes she gets really sad because she can see all the other children playing and running around, and she knows she can't. That's when I feel she's really suffering.
Michelle, like Maria and Hercules, is another officially unacknowledged thalidomide victim who's never received a penny in compensation. The increasing use of thalidomide in Brazil's leprosy program worries some experts.
The doctors use more thalidomide than the patients really need. And the patients like very much thalidomide because they feel better with thalidomide.
So do they become addicted to it?
Yes, thalidomide is a tranquilizer medicine, and the patients can sleep well, can feel well. They really like too much thalidomide.
Doctors in the southern Brazilian state of Sao Paulo were so keen on using thalidomide, they kept this young married woman on it for over 6 years. In the end, Eva Soares, desperate to have children, decided to take the risk. The result was Luis Henriquez, born with deformed and shortened legs and arms.
Hey, Henrique.
Had his mother understood the risk that she was taking?
The doctor did tell me not to take it when I was pregnant. She said it would cause problems for the baby when it was born. But she didn't tell me what kind of problems. She didn't give any details. That same doctor, when she found out I was pregnant, she said she felt like punching me. So I said, well, why don't you hit me then?
Louise's father is an unemployed bricklayer with no regular income. Yet once again, the family received no financial help for their son's disabilities.
As far as we're concerned, he's perfect, like any other child. We've adapted ourselves to him.
We adore him. There's no difference. Our problem is that we can't give him the medical help he deserves. He needs, that's all. He has all the love in the world, but our problem is money. We just don't have the means to give our child a better life.
While cases like Louise, Michelle, Hercules and Maria have been kept secret, these 3 victims from the southern Brazilian state of Paraná were the subject of an official report. It confirmed that thalidomide was the cause and awarded each of them a disability pension. Its recommendation? Thalidomide should only be handed out in envelopes with the written warning not to be used during pregnancy. But 4 years later, the warning failed when Darcy Menenguelo was also born in the same state of Paraná. More problems with the use of thalidomide surfaced in 1986 when this doctor from Sao Paulo was asked to examine a pregnant leprosy patient at his private medical clinic.
In 1986, we received a patient with leprosy, Hansen disease, and she took thalidomide during the first weeks of the pregnancy. And the fetus was severely damaged. We had the opportunity to check the fetus by ultrasound, and she decided to abort. I immediately went to the health minister, and he was astonished, but he did nothing.
With no action from the Brazilian government, Dr. Gollop wrote to this international medical journal describing the case. But had it come to the attention of the World Health Organization?
Are you aware of this journal?
No.
The case of a woman, a leprosy patient, given thalidomide, who became pregnant in Brazil and who was, who had to have an abortion. The fetus is shown there.
No, I'm not aware of. It was not reported to us, so I'm not aware of this.
Does that worry you?
Certainly, because it's possible that in certain conditions, certain situations, the strict precautions are not being taken, and it's a serious risk. And people should be told that whoever manufactures thalidomide and distributes, the responsibility should be clear that this is not given to women of childbearing age.
In part 2, we show how thalidomide's comeback in Brazil is even more seriously out of control, and we examine its use closer to home. Brazil's Amazon region, a vast area of river and rainforest, as large as Europe. Leprosy is growing faster in this region than anywhere else in Brazil. Today, 1 in 100 of the population of the Amazon suffers from leprosy, and in some areas it's as high as 1 in 50. Treatment of this epidemic is hampered by the vast distances. Francisco Nunes from the Amazon is the president of Brazil's movement for the reintegration of leprosy sufferers.
The problem here in the Amazon is worse than anywhere else because of the distances. As you can see here, to get from one place to another, you have to go by boat. It can take months to get from one place to another if you can't go by plane. There are no roads, and yet the Amazon region has got the worst leprosy rate in the whole country. It's as if you had an enormous carpet covering a vast problem. Just lift up a corner and you'll see leprosy everywhere.
Leprosy sufferers from isolated villages have to travel for days by canoe to reach treatment centres in the riverside towns. Both the parents and 2 of the children in this family have leprosy.
Ok, esse comprimido aqui não vou esquecer, tomar comprimido. Você trabalha na roça, então tomar comprimido à noite, tá? Não esqueça de tomar uma bandinha ao dia.
Their supplies of drugs are given to them to take away back to their villages. Just as in the rest of Brazil, the use of thalidomide is widespread.
Here in the Amazon, throughout the Amazon region, it's extremely hard to control the use of thalidomide because people here aren't used to preventing pregnancy. No one here takes the pill or uses a condom. That's very rare. Another problem is that the doctor or nurse giving out thalidomide really has to spell out the dangers. He has to be convincing because people here find it hard to understand the connection between a child being crippled and a mother taking a drug. Yes, it's harder to control here than in other regions.
The problems of controlling thalidomide led to this girl, Sandra da Silva, being born with short arms. She lives in an Amazon leper colony. And the mother of this boy from the Amazon, Rosivaldo das Graças, helped herself to thalidomide prescribed to her husband. Controlling the use of thalidomide in Brazil is often a battle against ignorance and lack of understanding. This man, Reginaldo dos Santos, was taking thalidomide for leprosy. With no idea of the risks, he gave some to his wife in the early part of her pregnancy. Their son, Fabio, now 13, was born with shortened arms. Amazingly, 2 months earlier, another boy from the same village in northeastern Brazil, Adelson, was born with the same thalidomide defects. Again, it was his father who was being treated for leprosy, not his mother. He and Fabio have grown up to be good friends. 600 miles away, near the town of São Luís, Josefa Santos Pinhas, a leprosy sufferer, is the mother of 9 children. Yet it was easy for her to obtain thalidomide without even having to go to the doctor. Her sister, also a sufferer, sent it to her through the post.
I was living in the countryside. My sister sent me some and I took it. I didn't know anything about it, so I took it when I was living there. I was ill, I needed something. These pills arrived, so I took them. I didn't get any advice. In the countryside, nobody knows anything about these things.
Her daughter Janelma is now 7.
Janelma is a shy little girl. She's only really happy when she's at home with us or with people she knows. but she's frightened of the outside world. She gets so embarrassed, like you saw on the beach. She's happy inside our house, but outside she gets upset.
With no financial help whatsoever for her disabilities, Janelma is growing up in abject poverty. Her unemployed father sells juice to the tourists on the beach to make ends meet, but on some days the whole family goes hungry.
If only she could get some help. I don't think she'll ever be able to work and support herself when she grows up. She's going to find life really hard, isn't she?
Our daughter's future is with us. We are all she's got to look after her, and we will. Without us, I can't see how she's got any future. She just won't make it in life.
She might be handicapped, but my God, I'll always love her.
As well as cases like Janelma, we found this little 7-year-old girl, Rafaela, in a Rio leper colony. She has a missing thumb and both her ears are damaged. Born with missing hands and a deformed leg, this young man, Ailton, and this 11-year-old girl, Carla, both live in the same town in central Brazil. 7-year-old Giselle, born without a toe, and Manello, aged 13, with deformed arms, live in the south of Brazil. Jacqueline Santos, aged 11, is also deaf and dumb. And another girl from the northeast, 8-year-old Patricia Chavez, who told us that she hates school because all the children call her short arms. The total number of new thalidomide victims that we found in Brazil, 21. And on top of that, we heard of 5 deaths soon after birth and 9 abortions in women who'd got pregnant while taking thalidomide. The last one less than a year ago. Brazil is notorious as a country where people can freely buy drugs and medicines that in Britain are only available on prescription. But would a drug as dangerous as thalidomide be for sale?
Would you think that it's possible to buy thalidomide?
No. As far as I know, it's produced by the factory that is related to the health ministry, and it's distributed only by health centers.
This wholesale pharmacy in Rio de Janeiro supplies thalidomide to hospitals. We sent a 23-year-old Brazilian woman in to ask for thalidomide.
It's thalidomide that I wanted.
Wasn't it 2 bottles of 100 pills?
No, I wanted 30, 3 bottles of 10.
Oh, 3 bottles of 10. Here you are. 3 bottles of 10.
Oh yes, 3 bottles of 10.
She was supplied with 30 tablets for £12. No questions asked and no warnings given. The pills were supposed to be for export. Instructions on the bottle were in English.
We sent a woman of childbearing age, a Brazilian woman, into a wholesale pharmacy in Rio de Janeiro, and she was quite easily able to buy thalidomide with no questions asked about her use of it and no warning given to her.
No, this is certainly not acceptable.
And if you'd like to look at the warning on that,
that's right.
What do you think of the warning?
I think the warning is not very clear. It should be made more clear.
But this is a woman who doesn't speak English. She only speaks Portuguese. And that's the only warning that she's given in English, and not in very clear English either.
Yeah, that's right. It's not very, it is quite vague.
In 1984, the WHO asked the German inventors of thalidomide, Grunenthal, to supply it for leprosy treatment around the world. Today, it's sent free to 38 different countries. Brazil chooses to produce its own. Last year, they made 8 million tablets of thalidomide, enough to treat at least 20,000 people. And they're not the only country producing thalidomide. Nearly 10,000 tablets a year are made here at this factory in South Wales for use in Britain. Thalidomide was brought back into British medicine as an unlicensed drug just over 10 years ago at Nottingham's University Hospital. Consultant immunologist Dr. Richard Powell reintroduced it to treat Behçet's syndrome, a rare condition causing severe mouth ulcers.
Prior to the introduction of thalidomide for these people, we used cytotoxic drugs, high-dose steroids, all with only marginal improvement in the patient's symptoms, but with a lot of side effects. And therefore for us it was with some relief that we'd at last found something that would help these people and restore some form of normality to their lives. Okay.
The Department of Health has no record of the exact number of patients receiving thalidomide. It's thought to be around 40. Heather Clark, a thalidomide survivor herself, is a journalist who's been monitoring the situation since she first heard that the drug had come back.
I mean, my instant reaction was obviously, you know, get rid of it, don't use it again. But then I thought, well, if it's doing some good, you know, let it and try and redeem itself somewhat. But obviously there's the worry that you'll have a repeat performance and you'll end up with babies and families going through absolute hell all over again.
Consultant obstetrician Dr. Tom Bloomfield is an expert on the effects of drugs during pregnancy.
Thalidomide is the only drug that with certainty will cause profound, severe physical disability to a developing baby. There are other drugs which might cause a problem, which might increase the risk of a problem, or which might cause a minor problem. But thalidomide is the only drug that with certainty causes a severe problem. So it's astonishing that the drug, above all, that made us worry about drug safety, made us worry about drug safety overall, and made us worry about drug safety in pregnancy in particular, that this particular villain, should be rearing its ugly head again.
We only give it to people who can adequately perform contraception, and we define that they've had at least 1 year of adequate contraception on an appropriate method, such as the pill or the intrauterine device. We also have to ensure that, if you like, the lady particularly is able to understand and comprehend exactly what we're asking of her.
It's fine, but some people would say that there isn't really any 100% form of contraception.
I accept that there is no 100% form of contraception, but you also have to put that against the benefit to these patients and also the very low numbers of patients that actually receive thalidomide.
The use of thalidomide is now growing. In America, it's being tested on TB sufferers, and in Britain, it's prescribed to AIDS sufferers for mouth ulcers.
Does it actually cure the disease of AIDS?
It doesn't cure AIDS, but it is absolutely essential in very few patients who have very severe oral ulceration who don't respond to any other treatment. It is a last-ditch treatment in people with very severe oral ulceration who are losing weight and are finding life quite unbearable. We give it to them to take away, but we explain to them very carefully what it is. We explain to them very carefully what the risks there are, and they are advised to keep it in a locked cupboard.
But it's not difficult to envisage a man with AIDS and ulcers and unpleasant complications of AIDS being given thalidomide and finding it very good, and perhaps helping someone out by letting them have some. It's particularly easy to imagine this amongst intravenous drug users who've shared a great deal of things, which is how, of course, they got in that predicament in the first place.
So, what's your reaction to the fact that more and more AIDS sufferers are taking it home and having it in their houses?
I think that's an accident waiting to happen.
You can't legislate against everything. Pregnant women may help themselves to weed killer if they wish to out of the garden shed, and that is even more dangerous. There are all sorts of drugs which may harm pregnant women. I think it would be sad if these patients were deprived of this drug. It would be a tragedy.
Well, I think when you've got doctors who give people medication to take home, you do run the risk of them maybe passing it on to granny, you know, or a young sister, someone has a headache. You just don't know, because that does happen so often. And, you know, going back to when I was tiny, it happened then.
30 years ago, Henry MacDonald was prescribed thalidomide for back pain. His pregnant wife unknowingly took a few of his pills from their bathroom cabinet. Their daughter Anne was born with short arms as a result. Tablets given to patients at Nottingham are not labelled thalidomide, and there are no warnings on the bottle. As yet, there are no Department of Health guidelines, but Dr. Powell is confident that risks are minimal.
I am confident that in the way we're currently using it, we have covered ourselves as best we can for that eventuality, and as yet it has not happened in 10 years, which is testimony to the fact that we are at least going some way towards that.
But would the evidence from Brazil change Dr. Powell's mind?
Yep. These are some of them, but not all.
Appalling.
These are people who live in absolute poverty. Again.
Okay, well, you've clearly demonstrated the cases, that I accept. But the guidelines we are using in this country and the strict regulations that are applied to its use have not demonstrated this problem.
How does our evidence affect the worldwide use of thalidomide and the endorsement of that use by the WHO?
If I were to show you some of these cases. This boy is 13. This child is only 3 years old. This boy is 9. This little girl is 7. This boy is 10 years old. This little girl is 9. This boy is 12. This little girl is 13. I mean, there was even a government report into these cases. This little boy. This boy. This girl is from the Amazon. And this little boy is only 3 years old. So it's happening right up until recently.
That's very disturbing. That's very disturbing. That the use of thalidomide is not controlled. It's very clear from these evidences, and it's very serious.
It's a scandal, absolutely. It's inexplicable, really, how people can practice medicine and know that this is going on and still want to use the drug. It may be that these are poor, inarticulate people, and maybe they just feel it doesn't matter, but no way we can tolerate this any longer. It's just got to be withdrawn promptly, as soon as possible.
Okay, it's a failure, I see clearly.
Do you not think then that it would be wise to look again at your strong recommendation for the use of thalidomide?
Certainly, we will bring it up during the next review. There are other drugs available that might come in the future that could be used. But the fact cannot be denied that thalidomide is the best drug for leprosy action. And according to experts, that certain patients, they don't get thalidomide, they will end up with lifelong problems.
30 years ago, 8,000 children were affected for the rest of their lives by thalidomide. How could it be that a drug whose effects are so well known could still be allowed to maim innocent victims today?
This little girl is perhaps the most tragic case of all. She's got 8 brothers and sisters, and they're totally poor. Some days they don't eat.
Maybe the medical profession, or I certainly hope they will, there's no maybe about it, they damn well ought to take a long, hard look at what's going on.
And what do you think should be done with thalidomide now?
My instant thought is, you know, never use it again.
It's frightening to think that in Brazil, a drug which wrought such havoc has slipped past our defences again. Here, the Department of Health says that thalidomide may be given to experienced doctors for a small number of named patients with diseases unresponsive to other treatments. The department says it sees no reason to change this practice. We'll be back in July. Until then, good night.